I'm Dr. Bikram Dhillon. I help people prevent disease to live longer, healthier lives. And today, we're going to talk about problem number one. Here's the number to remember. It's 40. 40% of people with heart disease have a normal cholesterol. That's right, normal, 40%. Now, that's an incredible number to think about when we've been conditioned to think of cholesterol as the marker of heart disease risk. In my deeper education video series, I discussed the importance of omega-3s and fish oil. Now there, I was only able to talk briefly about the heart benefits of fish oil. Now, we're going to get into some more specifics. To do that, I'd like to back up a little and talk about why so many people who get heart disease have what looks like normal cholesterol. That discussion can help you to understand the problem in a little more detail, and it can help you decide what you can do about this problem. This is our first podcast. It's first because heart disease is the number one killer of men and women in the US today. And my goal is to help you live longer and live healthier. So why not tackle the biggest identifiable problem first? So to get to a solution, we need to understand that the story we've been told is only a part of the problem, and it may not even be the biggest part of the problem. You see, for decades, we've been told that cholesterol, especially LDL or low density lipoprotein, the bad cholesterol as it's been called, is the main villain in heart disease. But when we look closer, the story is not so simple. The real story is what's happening beneath those numbers, inside the lining of your blood vessels. This conversation today about cholesterol, omega-3s, and your heart is about far more than just a single set of cholesterol test results. It's about understanding why your arteries become inflamed, why your lipids misbehave, and most importantly, how you can take back control of your cardiovascular destiny. So let's get going. Now, every day in medicine, we see people who've been told, your cholesterol looks fine. There's nothing to be concerned about with your cholesterol. The implication is there's nothing to be concerned about with your heart, yet they go on to have a heart attack or a stroke. How does that happen? Well, in my 30 plus years as an emergency physician, I saw it happen routinely. People with total cholesterol levels below 200 having heart attacks or impending heart attacks, angina. Why? Well, the answer lies in inflammation, specifically inflammation of the endothelium. That's the thin lining of your blood vessels, just on the inside of the blood vessel. When that lining becomes irritated by toxins, stress hormones, oxidized fats, high blood sugar, or even chronic sleep deprivation, it loses its protective, non-stick quality. Instead of blood flowing smoothly, cholesterol particles start getting trapped in the walls of the blood vessels, oxidized and engulfed by immune cells. And this starts the process of thickening and then narrowing of the arteries. And that's not just a cholesterol problem, that's primarily an inflammation problem. And that inflammation is silent. It doesn't cause pain, you don't feel it, but it is measurable if you know where to look. So where do you look? We look at several tests. We look at an elevated hs-CRP. That's a marker of systemic inflammation. That's an independent risk measure for heart disease. We look at high triglycerides and small, dense LDL particles. We look at apolipoprotein B. We look at omega-3 indices and an omega-3 index that's below 5% or a high omega-6 to omega-3 ratio, meaning your diet is tilted heavily towards inflammatory fats. When I see that pattern, I know that the endothelial lining is under stress, and that's when we need to act. Not later, when symptoms finally show up, but now, when we find these test results. That's what preventive medicine is all about. It's testing and acting now, not waiting for symptoms to show up. It's about dealing with the underlying problems we have now to avoid the larger problems that might lead to later. So you might ask, how did we get here? Have we always had these problems? How did inflammation and this imbalance become so common? Well, a few decades ago, we changed what we ate and how we lived. We cut back on natural fats like fish, olive oil, and butter, and we replaced them with processed seed oils, corn, soybeans, safflower, high in omega-6 fats, especially corn and corn oil. Yeah, our sugar intake also skyrocketed, and we started eating more refined carbs. We got less sleep and started bathing in a constant stream of low-level toxins, from plastics to pesticides to chronic psychological stress, anxiety. Each of those alone might be manageable, but together they create what I call the modern inflammatory storm. The problem is really a web of problems, and you'll need to address each one of them if you want to solve this problem for yourself. So it's not just one problem, it's addressing all of them, and that's what will help you, and I'll help you to tackle each of these. Today, with our time today, I want to talk with you about one of the most important pieces, and that's your omega-3s, the EPA and DHA from marine sources. And these are nature's antidote to that storm. They are so important that I include them in our Core 5 supplements for all of my patients. Omega-3s help restore inflammation. They make your blood less sticky. They stabilize heart rhythms, and they literally change the composition of your cell membranes, making them more flexible and resistant to change, decreasing inflammation in every one of your cells. Now, here's the problem. The average person's omega-3 index is around 3 or 4%. We evolved with levels closer to 8 to 10%. And I now see omega-6 to omega-3 ratios routinely in the upper teens and 20s, when we evolved with ratios of 4 to 1 or even less than 4 to 1. So our hearts are trying to operate in a world they were never designed for, one that's filled with inflammatory toxins and is deficient in these anti-inflammatory molecules that we used to get routinely. It's a complex story. It might help to hear about one individual. I once had a patient, a 58-year-old man with a long family history of heart disease and multiple early deaths from heart attacks, including his grandparents. His total cholesterol was 180 with an LDL of 105, normal. But he was tired, his triglycerides were high, his hs-CRP was elevated, and his omega-3 index was 3.4% with an omega ratio of 16. And I told him, your cholesterol numbers look fine, but your arteries are likely inflamed. Your body is acting like a house with old rusty pipes. The problem isn't the water flowing through them, it's the lining of the pipes. So we worked together for 6 months. We used an integrated approach that included dietary changes of reduced refined oils and sugars. We added cold water fish twice a week, used a high purity EPA, DHA fish oil supplement as part of his daily supplement routine. When we rechecked his hs-CRP 6 months later, it had dropped and his omega-3 index had risen above 7%, with a ratio of close to 6 to 1. His inflammation had dropped and his energy and exercise tolerance returned. He was hopeful for the first time in more years than he could remember. So it was a great intervention for him. And that's the difference between chasing cholesterol numbers and restoring true vascular health. If you take one message from today, let it be this: focus on calming the inflammation, not just lowering the cholesterol. And here's how you can start. First, check your markers. Ask your physician for an omega check. Your omega-3 index should be 7% or higher. Get an omega-6 to omega-3 ratio. Target that to 3:1 to 4:1. Check your hs-CRP, your LDL particle size, your apolipoprotein B, your ApoB, and LPA if possible. Rethink your fats next. Replace processed seed oils with natural fats, avocado oil, olive oil, and wild-caught fish. Favor smaller fish, sardines, mackerel, or anchovies. Even 2 servings per week can shift the balance. Third, add a high-purity EPA-DHA fish oil supplement. Look for third-party tested triglyceride forms with combined EPA-DHA around 2,300 to 3,000 milligrams per daily. Based on your lab test, you can optimize that. And if you need help, our website has great resources for you to look at for fish oils that we've already vetted. Reduce the hidden fires next. Manage stress, sleep, and toxin exposure, because each one of those drives endothelial inflammation. Simple things like a nightly wind down routine, filtered water, and regular movement can make a measurable difference. Remember that doing something is better than doing nothing at all. And finally, integrate. Don't isolate. In the Physician's Total Wellness Framework, omega-3 optimization is part of our core 5 supplements and the heart health focus protocol, along with vitamin D, B12, folate, and gut health support. Now, these systems work together to reduce inflammation, stabilizing metabolism, and supporting longevity. So to sum it all up, think of omega-3s as the anti-rust coating for your arteries. They don't just prevent the damage, they can help your body to repair it. And the next time you think about cholesterol, remember, your heart health is not just about measuring one number. It's just as important to measure how well your vascular system is aging, your omega balance, and how much inflammation is going on. With the right tools, good nutrition, exercise, good data, and good habits, you can keep those arteries flexible, resilient, and clean for decades to come. Fighting a battle with only one weapon is not a way to win. Fighting to keep your heart healthy is the most important thing you can do for your health. You only have one heart and one life. Be sure to use every tool available in fighting for yours. I'm Dr. Bikram Dhillon. Be well to excel.